1. Appetite and rumination. It is the most reliable indicator of cattle health. Generally, as long as the cattle are sick, their appetite will be affected first. It is very important for early detection of diseases to check whether there is leftover feed in the feeding trough in the morning. In addition, rumination can be a good indicator of cattle health. Healthy cattle ruminate for about 8 hours a day, about 6 to 8 times in total, especially at night, with rumination time for about 30 minutes each time and about 60 times of chewing. 2. Body temperature. The normal body temperature of adult cattle is 38 to 39 degrees Celsius, and that of calves is 38.5 to 39.5 degrees Celsius. The ear of cattle is normally warm, neither hot nor cold, and the ear tip temperature tends to be lower. In addition, the presence of water droplets on the nose is also a symptom of body temperature. 3. Breath. Adult cattle breathe 15 to 35 times per minute and calves breathe 20 to 50 times per minute. It mainly depends on rumination. There is basically no problem if rumination is uniform. If the breath is fast and slow or dare not breathe, then we should consider whether the feed is stuck in their stomach, whether there is traumatic reticulitis, and whether there is myocarditis or pericarditis. Sometimes we can't see the symptoms at all. It depends on our usual observation. 4. Pulse. Generally, the pulse rate is 60 to 80 beats per minute for adult cattle, 70 to 90 beats for young cattle, and 90 to 110 beats for calves. 5. Excretion. Normal cattle defecate 10 to 15 times and urinate 8 to 10 times a day. The feces of healthy cattle have appropriate hardness, and the cattle dung is section by section. But the fattening cattle dung is slightly softer, and the excretion frequency is generally a little more. Urine is generally transparent and slightly yellow. 6. Belching, 20 to 40 times. Belching is a kind of gas produced after the fermentation of cattle stomach food, which will come out when ruminating. Cattle stopped when it is eating, as if taking a breath. This is belching. It smells sour, but not stink. If it smells stink, then we should consider chronic gastric ulcer.